Hi everyone, happy Victoria Day. If you're living here in Canada, it's a beautiful Monday morning or almost noon now here in Canada, in Ottawa, where I am right now. If you're in the States, hopefully you have a really good start to the week. And today I want to talk to you about light. And as you can see, I'm outside, I hear the birds, I hear some dogs, some cars. But why do we want to be outside as much as we can when the sun shines? So this is something that I really want to talk to you today about because it's so important, especially when we're dealing with a thyroid condition. Love and sunshine is our best friend when we're dealing with this. So let's look into this a little bit. The vitamin D levels for most of us dealing with Hashimoto's and thyroid conditions are usually pretty low. So if we're not supplementing with vitamin D, or if we live in an area where we don't get a lot of sunshine, our vitamin D levels are usually lower than already the average population. And the average population usually has a low vitamin D level. So this is why, we want to make sure our vitamin D levels are okay. And sunshine is really the best way for us to get the vitamin D in. So if you are like me, you're living in an area where most of the year we don't go outside very often and there's not a lot of sunshine, we need to make use of every ray of sun we can get. So if you have the chance, go outside and work outside, sit outside when the sun's shining like I'm doing here today, sitting in my beautiful garden. This is really important for your thyroid, for your skin, for your vitamin D levels. So get outside, be outside as much as you can. Another thing I want to mention today is I've been looking into studies for red light. And again, we're talking about light. It's always about light. And there is red light therapy, and there are actually a lot of studies when it comes to red light. There are about 5,000 studies that look into all kinds of different aspects how red light can benefit your health. And a pretty exciting find is that there have been studies done on thyroid conditions and Hashimoto's when it comes to red light. So this is huge, and it's not just one random study. There are several studies that talked about this. And actually, if we were exposed to red light, and we can do this with a red light lamp, these studies showed that 38% of those people who were exposed to red light on a regular basis were able to reduce their thyroid medications. I mean, that is pretty amazing. 38% were able to reduce their thyroid medications. And 70% of those people were actually able to stop their medication altogether because their thyroid had recovered and improved. So that really shows us that the thyroid does need the light waves and different exposures to light in order to function optimally. And that can also be a reason why sometimes our thyroids struggle, especially if we're homey persons and we don't spend much time outside. And also a large majority in all studies actually showed that people were able to reduce their medication. And also there are studies who showed that people were able to reduce their antibody count when exposed to red light therapy. So I think that's pretty amazing because that's a really, really high percentage. So if you've never tried red light therapy, I really encourage you to do that. And it's very simple because you can get those red light lamps on Amazon, on other retailers as well. They're as simple as just screwing it into a lamp holder and exposing your thyroid. You want to expose the thyroid, the tissue here, to that red light, and you don't need a whole lot, like maybe 15-20 minutes max in a day. You expose your thyroid to the red light. And I have already ordered mine, and I can't wait to get started. And in the meantime, I make sure that I spend as many days outside as I can being exposed to beautiful sunshine, because again, this part here of my body just loves the sunshine. So, as you can see, I'm pretty amazed by those studies, and it's really interesting because those studies said that no matter what it is, it's also for weight loss, for muscle recovery, red light seems to just accelerate tissue healing, right? And if you're dealing with Hashimoto's and the attacks on your thyroid, you really want to make sure you have or find a way where your tissue can heal, you know, so that the tissue of the thyroid doesn't get destroyed as much as it would maybe otherwise. So red light therapy might be very promising. And I can also tell you that in my new program that I just launched, it's brand new, we will use red light therapy in there as well as one of the many tools that I will teach you there on how to get, you know, your thyroid back in check, your energy back in check, and your overall well-being. So this is really something that I'm giving away here for free, but it's very powerful, very promising. And before I let you go, I really want to tell you this, and I come across this all the time. You know, we have to take ownership of our own health. We cannot give this power away to anyone. We can't say, well, the doctors will tell me what to do, you know, my health practitioners will tell me what to do. No, we have to take action. We have to find whatever we need if we want to get better that can help us with this. And we have to take action, and we have to control over what we're doing and how we're living our life, because it's all connected, it all comes together, you know. And if we don't do this, we really fall victim to our environment. We fall victim to, you know, the way the world works around us. So I really want to encourage you, take action, take the ownership and own your health. And if you need help with this, please reach out, because my new implementation program is very empowering for you to get the help and the strategies to stay on track and move in the right direction. So I'm hoping this was helpful. Go get some sunshine in, consider red light therapy, go have a chat with me, whatever you need to do to take ownership of your health. Please go and do it, and I hope you have a wonderful day. I will talk to you soon. Bye-bye.